Hello and welcome. I'm Dr. Julie Connor, owner of Healthy Ways Wellness Center in Brookfield, Connecticut. I'm going to be talking today about functional medicine, which is the future of healthcare. Here's an outline of my presentation. I'll be talking about my family and the foundation of our practice, my educational background, my credentials, the evolution of my 35-year practice from nutrition counseling services to Healthy Ways Wellness Center, the integrative services that we have at Healthy Ways Wellness Center, and what functional medicine is. I'll also be talking about why functional medicine is the future of healthcare, the training of a board-certified functional medicine practitioner, the types of patients that I work with, the functional medicine assessment, both Part 1 and Part 2, Genova diagnostic testing, supplements, herbs, and CBD oil, and how I can help you. Some important health secrets to help you get started on the path to optimal health. First of all, here's myself and my husband. Will is the CFO at Healthy Ways Wellness Center. We've been together since 1979, so next year is 40 years, and we just celebrated our 36th wedding anniversary. Here's my family, my children, Billy, who's the oldest. He is the office manager at Healthy Ways Wellness Center. My daughter-in-law, Mary Alice, who is Dr. Brian's wife, and Emily is my granddaughter, who he's holding. Dr. Brian's our medical director. He's a nutritionist and chiropractic physician at Healthy Ways. And my daughter, Christy, on the far end. Just a little bit about my background. I have a bachelor's degree from Cornell University, and I did an internship at Westchester County Medical Center in Valhalla, New York. I went on to both New York Medical College, and then I did additional advanced training. Here are my credentials. People ask that all the time. I'm a registered dietitian. MPH is a master's in public health. PhD, I have a doctorate in holistic nutrition. CDN, I'm a Connecticut certified dietitian nutritionist. IFMCP, I'm board certified in functional medicine from the Institute for Functional Medicine. ECHN, I'm board certified in holistic nutrition. I'm a certified health coach, and I'm certified in adult weight management. In 1983, I started my private practice, and at that time I had 4 offices all over Westchester, Dutchess, and Rockland counties. And in 1995, I purchased Healthy Ways Wellness Center, and I changed the business name from Nutrition Counseling to Healthy Ways. And between 2011 and 2012, Healthy Ways added a 3,000 square foot addition in anticipation of Dr. Brian Connor, my son, and Dr. Billy Connor, my other son, joining the practice and expanding the business. So here's our new facility at 366 Federal Road in Brookfield, Connecticut. The services we offer at Healthy Ways Wellness Center are very integrative. We have nutrition counseling, and that's with both Dr. Julie, myself, Dr. Brian, and Colleen. We offer functional medicine with Dr. Julie and Dr. Brian, massage therapy with Greg and Dorothy Ann, acupuncture with Chris Shiplow. Dr. Brian is also a chiropractic physician, energy medicine with Pam Picard and Dawn Eriquez, hypnosis with Susanna Burns, as well as guided imagery, personal training with Steve Troiano. Cynthia Buzak is our cosmetologist who does spa services like facials and waxing, and Dr. Brian also does DOT and CDL physicals. And here's the wonderful team at Healthy Ways Wellness Center. So now let's get into functional medicine. What is it? It's a patient-centered approach to medical care. So the functional medicine practitioner and the patient work very closely as a team to ultimately derive at a personalized and individualized plan that the patient needs to follow to achieve optimal health. And functional medicine addresses imbalances in the body. So we're looking at diet and nutrition, stress, exercise, relationships, sleep, spiritual, emotional, and mental imbalances, as well as we do comprehensive diagnostic testing, which is not done in traditional medicine. We do vitamin and mineral testing, toxic metal testing, and food sensitivity testing. And why functional medicine is the future of healthcare? Well, patients are frustrated with the limited time, typically 10 minutes, that they get with their primary care provider or the specialist that they've been referred to. patients really want more comprehensive care. They're frustrated with being passed from specialist to specialist and just receiving a pill for every ill. And they're tired of taking so many medications and then dealing with the side effects of those medications. So there's really no practitioner looking at the total patient, and patients really want that. So functional medicine treats the whole patient, not just one area of the body. And the functional medicine practitioner evaluates the root cause of the medical symptoms and the problems that the patient presents with, rather than just addressing them with a diagnosis that the patient was labeled with. So functional medicine really does provide the answers. Let me tell you a little bit about the Institute for Functional Medicine Board Certification Program. It is an extremely difficult and comprehensive program, and it looks at all areas of medicine so that the practitioner is prepared to handle very complex cases involving multiple systems of the body. So the credentials of a board-certified functional medicine practitioner, IFM-CP, Institute for Functional Medicine Certified Practitioner. So the program takes between 3 to 5 years to complete. It took me 3 years, and my son, Dr. Brian, 3.5, and he's taking his board exam in November 2018. The coursework includes, the first one is called AFM-CP, Applied Functional Medicine and Clinical Practice. And then there are 6 modules: hormones, detox, gastrointestinal, cardiometabolic, immune, and energy. Then we also do a case study and take a board exam. And there are many practitioners who take an AFM-CP, which is the first step, but very few with complete board certification due to the length of the coursework. And this symbol, IFM-CP, is a symbol of a certified practitioner. And there's no typical functional medicine patient that I work with. My patients really vary. I see infants, children, teenagers, and adults. My oldest patient right now is 85 years old, a patient that I've seen for over 25 years. And I do both in-person, phone, or online consultations. And I've listed some of the areas that people may come to see me for: obesity and morbid obesity, eating disorders like anorexia, bulimia, and binge eating, underweight, high cholesterol and triglycerides, gastrointestinal diseases, gluten sensitivity, other food sensitivities, diabetes and prediabetes, nutritional deficiencies, toxic metal overload, and so much more. So the functional medicine assessment we break up into 2 parts. We call it Part 1 and Part 2. Part 1 is 3 hours, and I'd like to talk a little bit about that. It's extremely comprehensive and very thorough. And prior to the functional medicine visit, the patient fills out a very extensive questionnaire. And the honesty, detail, and accuracy of this questionnaire helps the practitioner start painting a picture on the blank canvas of the patient's overall health and their life history. So the practitioner completes what we call a functional medicine timeline, which begins prior to the patient's birth and goes all the way to the present. And we look at all the mediators, antecedents, and triggering events that brought a patient to where they are today. It's like peeling an onion. The layers of the critical life events, stressors, and health crises are discussed, and we plot them on that timeline. The practitioner then retells the story of the patient's life. Often this is very emotional. A functional medicine matrix is then completed to categorize all spiritual, mental, emotional, and physical symptoms that the patient has. After the matrix and the timeline are completed, it's time to evaluate the next step in the assessment process. We do a weight, a body mass index, blood pressure, and body measurements. And I also do body fat analysis using near-infrared spectrophotometry. I use that to evaluate a patient's lean mass, excess reserve, and essential fat. As part of the functional medicine assessment, I also do what we call a nutrition physical. Here's an example of something I would look at. This is thin, brittle, and cracking nails on a patient, which a functional connection can be malnutrition, such as iron, vitamin C, vitamin A, B6, protein, zinc, biotin, essential fatty acids, calcium, thyroid issues, osteoporosis. I also look at things like teeth. Here's an example of somebody with Burton's lines, and this could be a lead, cadmium or mercury toxicity. Here's a geographic tongue. There could be a tendency towards allergy, and if it's painful and it's a geographic tongue, it could be associated with iron, folic acid, B2, B12, and niacin deficiency, and associated with some kind of systemic inflammation. After the matrix and the timeline are completed, it's time to evaluate the next steps in the assessment process. We do a non-invasive biophotonic antioxidant scan in our practice to give a cumulative score of 18 different nutrition pigments. We're really looking for a score of over 40,000 for optimal health. We also do a wellness scan using BioEnergetic Medicine to test 172 bioenergetic markers of health. At this point, we have a better understanding of what additional testing is needed. Testing is typically ordered at Part 1, and we do Genova diagnostic testing here, allergy antibody testing, Nutrival testing, cardiovascular and gastrointestinal testing, as well as hormone testing. And Part 2 of the evaluation is between 1 and 3 weeks after Part 1. And at that evaluation, the results of all the diagnostic testing is reviewed. A health program is developed. We develop a health, food, nutrition program, a supplement and herbal program, and come up with lifestyle modifications that the patient needs to make. Follow-up includes testing and treatment. So we use supplements, herbs, and CBD oil in our practice. And the supplements that we use are very high quality and pharmaceutical grade and third-party tested. Supplement lines include Standard Process, Metagenics, Nordic Naturals, Designs for Health, and Pure Encapsulations. We use herbs that are high quality and pharmaceutical grade, third-party tested. They're so pure, the medi-herbs that we carry, that you must have prescription in Australia to actually get them. We have a very high quality CV Health CBD oil that we use. The hemp is harvested in Holland and at a European ISO certified facility. They bring it over to a state-of-the-art lab in San Diego, California, and they third-party tested for concentration, quality, and safety. And we carry it here in soft gels, oil drops, gummies, and balms. And that CBD oil is very effective for things like pain and anxiety. So both the wellness and the biophotonic antioxidant scans we have found, I've done them for years and I've done thousands of them, they're negatively impacted by a poor intake of fresh fruits and vegetables. So you should really be eating a rainbow of phytonutrients. Stress can also negatively affect your scans. So make sure that you learn to manage your stress, because stress is a killer. A high BMI, so please reduce your weight if you're overweight or obese. Inadequate nutrition, so if you're not getting the nutrition from food and you're not taking any kind of supplement program, because it is difficult to get everything that you need from your food, you may have a lower scan. Medical problems, so typically patients that have medical problems have lower scans. So work on improving your overall health and reducing your risk of disease. So how I can help you? So here are some important health secrets to get you started on the path to optimal health. Eat a colorful, what we call phytonutrient-rich diet. Try to add additional activity into your daily routine throughout the day. Try to get at least 8 hours of sleep. Seek out supporting relationships in your life and work on managing your stress level. Also limit sugar, saturated fat, trans fat, and artificial sweeteners. Use organic as often as possible. Shop local if possible, like in farmers markets, and know where your food is grown. Avoid the use of Roundup, which is glyphosate and an endocrine disruptor, and so avoid using that on your lawn. And test your well water periodically for bacteria and contaminants. I'm also recommending to keep a food diary for a few days. That's very revealing. Increase your hydration, so focus on water. Pre-plan your meals and snacks, so cook in advance so you are prepared. Find a buddy that wants to get healthy with you. Support is essential for making positive improvements in your health. And I highly recommend to seek out a board-certified functional medicine practitioner to help you. If you have any questions or you'd like to know more about the functional medicine assessment, please call us at Healthy Ways Wellness Center at 203-775-1819, or you can email us at reception@healthyways.com. Thank you very much and have a great day.